This morning on BRN, understanding aging requires more than counting birthdays. And joining me now is Idan, Shalev and Abner, Apsley of Penn State University. Doctors, great to see you. Thanks for joining us on the program this morning.
Thanks for having
Thank
us.
you.
There's so much in the study of aging, and we're really pleased to have you kind of discuss your work. And Abner, I want to start with you. Just a basic question, just to kind of level set. Is there a difference between our chronological age, so I am 52, I'll be 53, versus our biological age? And if so, what are the differences?
Yeah, that's a great question. So, chronological age in general measures the number of birthdays that you've had since you were born. Biological age is kind of aiming to get at something a little bit deeper. So, you're measuring kind of the biology of the individual and how much their body and their cells and tissues have deteriorated over time due to the effects of time. So, someone could be 55 or so with their chronological age, but have the body of a 40-year-old, or vice versa. They could be, 40 years old and have the body of a, 55-year-old or whatever it may be. So the biological age is kind of a measure that we're looking at to kind of get an idea of where their body is in terms of how much it's deteriorated over time.
And so we probably don't want to count the candles on a birthday cake. We want to look a lot deeper. How do you go about getting that information? Is it I think traditionally there were tests around swabbing the saliva out of your mouth, but I think you and Abner have come up with a different approach.
Yeah, so there are several approaches to calculate biological age. There are a lot of investigators are working on that topic. And the method that we use in our work is probably the most common metric now that people use nowadays, because it seems to be the most accurate measure that can predict disease and mortality. So it entails collecting samples, and in our work, we collected multiple types of samples from saliva, from buccal swabs, from blood. It's most commonly done from blood. And then what you do with those samples, you extract the DNA, and then you measure chemical modifications on top of the DNA, what's known as DNA methylation or epigenetics. And there is an algorithm that other investigators have developed that you use this information to calculate the biological age as parallel to chronological age. It's calculated in years.
Yeah, and Abner, it just sounds like logically, if I'm concerned about my health, and I think most people are concerned about their health or should be concerned about their health, this is probably a number. Your biological age is probably a number you want to know, or maybe you don't want to know. I don't know. Don't you agree?
Yeah, I guess it depends on who you are, but yeah, you definitely, I think, if you're interested in your health and want to know if you need to be more engaged in healthy lifestyle habits, and things like that, knowing your biological age is a good kind of measurement of that place that you're at biologically, if that makes sense.
And Idan, is this readily available? So are these types of tests, like if someone's watching this program, I hope there's a lot of people watching the program, but if someone's interested in this, can they just go down? How do they get access to this, or can they get access to this type of test?
Yeah, this is a good question. Part of the reason we did the work that we did is because there are commercial companies out there who are offering biological tests. So they will send you a saliva kit. You will spit inside the tube, you will send it back to them. They will extract the DNA. They will measure your biological age. But there are considerations of which tissue sample you use. So the comparison between DNA from blood and DNA from saliva is not the same. Most commonly, it's done in research settings. So currently, it's not being used in clinical settings as a diagnosis. It's not a diagnosis of a disease. It can tell you your risk to develop certain diseases. So it's not offered to the public as a diagnostic tool, but there are commercial companies out there who are offering to measure your biological age.
And because they're, forgive me because I'm a layperson, but if they're measuring your saliva versus some of these more these other tissues, is there a deviation in terms of accuracy, Idan? Like, for example, is it going to say I'm 47 and a half versus 47, just plain 47, as opposed to age 52, which is what I
Yeah, so I'll give you an example. So what we did in our work, we collected samples from the same individuals. So from the one person, we collected saliva, the buccal swabs, and blood. And then we extracted the DNA and we measured the biological age. So for the same individual, if you calculate the biological age, if you use saliva as an example, that individual might be 20 years older compared to the biological age measured in blood. So there are some differences, and this is why we're being very cautious. And if individuals want to measure the biological age, they need to measure it in the sample, in the tissue that a biological age was developed, which is mostly blood. So you can be much older biologically if you're measuring your saliva versus your blood, so which is not good.
Yeah, I would prefer to be, Abner, I'd prefer to be on the other side. It sounds like what you and Idan are working on is much more, I'll just put, these are my words, you don't have to be your words, much more accurate. And have you spoken with primary care physicians and people that advise patients and say, hey, it would be great to get this data because it would help with the predictiveness of certain diseases?
Yeah, I would love to see this type of measurement being used in the clinic more. We haven't spoken personally with any clinicians or physicians, but hopefully the work that we're doing can kind of put it on the radar of these individuals to start looking at introducing these tests into the clinic and stuff. And I think, yeah, I think it's same thing with DNA testing, right? Like testing people's DNA. There's some tests that are common in the clinic right now, but I think in the future we'll hopefully see more and stuff. So same thing with this type of biological clock.
Yeah, and Idan, just to kind of close out the conversation, I mean, we're trying to move, I think, our healthcare system to a more proactive type of treatment rather than reactive, right? I mean, that I think ultimately is the goal. Having this type of information at hand for a practitioner would probably make a lot of sense to say, hey, you're predisposed to these types of things or that type of thing, right? I mean, it just seems like what you and Abner have created or are working on aligns really well to that shift.
Yes, so that's the hope that we will be able to use some of these tests to diagnose individuals like future diseases. But it's also complicated because we are tapping into the process of aging, and aging is at the core root of a host of different types of diseases. So one individual in their 70s may develop cardiovascular disease, and other individuals will develop type 2 diabetes, another one will develop cancer. So currently we don't have the tools to know exactly what type of disease one individual will develop. But we are hoping it will be clinicians will be able to use that in the future. I should also mention that currently we're using that in intervention studies. So there are a couple of interventions that are known to extend health span, that these are the healthy years that individuals live free of disease, to test whether those interventions can slow down the rate of biological age. There are some indications that caloric restriction can help. There was a recent work showing that omega-3 supplements can perhaps slow down aging. So there's a lot of these interventions are out there and are currently being tested.
Yeah, well, look at the other side of. I'm on the other side of 50, so I definitely have a vested interest in wanting to slow down a little bit of the aging. Idan, Abner, great work. Thank you so much for joining us. Good luck on the rest of your research, and we look forward to having you both back on the program again very soon.
Thank you.
Thank you. Thank you for having us.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Details, of course, at our website. And your subscription helps underwrite all this great BRN content. And we're back again tomorrow for another edition of BRN. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.